Today I want to talk to you about diet. And you might think because I'm a dentist, I'm going to say, don't eat sugar and don't have sugary drinks and don't drink too much juice. I do say all those things to my patients, but the more I learn about diet, and some of the information I've gathered from a dentist many years ago named Weston, who went around the world to remote tribes and also big cities and discovered that the diets of the remote tribes supported big, wide dental arches and beautiful teeth with no decay. And nowadays, we fight decay so hard. And every child well, not every child, but most children need braces. So that wasn't the case many years ago. What changed? So I would say the biggest change was the Industrial Revolution and changes throughout society that happened all along the way because of that. People got busier and they had to take care of their children in different ways, less nursing, which was done back in those days and in those tribes. Women would nurse their kids until they were 4 years old. And then they go right from nursing to solid foods, and they don't wait till 4 to feed solid foods, but as soon as they're getting teeth, they're introducing solid foods, not baby food out of a jar or even pureed food. So the other thing that's different is the nutrient level. We've seen a significant drop in nutrients, and there are some nutrients that if we follow the standard American diet, which is busy lifestyle diet, quick processed foods, fortified cereals, fortified wheat, fortified products wrapped in a package that could last 2 years on the shelf. Those sorts of foods actually rob our bodies of the nutrients that we need. And then it causes the body not be able to fight with the natural defenses that we were supposed to be given when we eat the proper nutrition. So what are some of the proper nutrition things that we have to think about? There are three vitamins in particular, that are super important. One of them is vitamin A, one is vitamin D3, and the other one is vitamin K2. And those mainly come from animal sources. So vitamin A supports bone development, but it has to have its partners, and that's vitamin D and vitamin K2. Vitamin D turns on thousands of genes throughout the body, and it also helps calcium get into the bones, but it can't do it alone. It has to have vitamin A. It has to also have vitamin K2. And vitamin K2 works to get the calcium into the bones, into the teeth. So when you have calcium into the teeth, that's where the natural defenses come from. And so I'll throw one other important vitamin or mineral in there, and that's magnesium. So all four of these things work together to form a strong defense. So not only is it a strong defense for your teeth, but it's a strong defense for your bones, helps to prevent osteoporosis, helps your muscles, helps your brain in so many ways that there's lots of research based on that. But if we go back to K2, it is, like I said, a transport mechanism that gets calcium into the teeth and into the bones. And that's where we want it to be. And in modern living, osteoporosis is a huge problem in women and even some men as well. It's also a problem in children and adults with their teeth. So what happens is in the decay process, if we're consuming sugar, which, yeah, sugar's not good. It isn't. Sugar will cause the acid change in the mouth that I've already talked about, and it feeds the bacteria, throws off the oral microbiome, and what happens is the teeth have to start releasing calcium that makes up the enamel of the teeth. So it has to release that calcium to help change the pH to fight the bacteria that are trying to get into the tooth. So that's kind of detailed description of what's going on, but it's a battle every day. And if we're constantly assaulting our teeth and our children's teeth with candy and even crackers with fortified wheat and wheat that has been sprayed with pesticides and all those things, it's actually a nutrient deficient part of their diet that actually reduces their immune response, both physically in the possibility of getting colds and flu, and in being able to fight decay in their mouths. So, what are some sources of these healthy vitamins? Vitamins A, vitamin D3, and K2. Well, you can take a supplement, and I sell it here at my office, but you can get this many places. D3K2. You never want to take D3 all by itself, because that actually by itself in excess can cause kidney stones. You must have K2 with it. K2 is important in a combination, as I talked about before. So vitamin A, vitamin D3, vitamin K2, some magnesium. These 4 key ingredients are what make healthy building blocks for our body and keep things in check. So where do we get these vitamins? What are some sources? Well, it's things that are now in the modern society kind of demonized, and we have to kind of go back to our roots, like Weston Price was trying to say back many years ago, that we need to eat red meat. And it's not just any red meat. It's not grain-fed red meat, which is feedlot beef and things like that. Those are low in the proper vitamins. We want more grass-fed beef and know your farmer so that it's sustainably raised. And that's what delivers the proper nutrients. So beef, liver, fatty fish, and eggs. All these things that are considered, maybe we shouldn't have too many of those things. We should have more of the grains. What we're finding is that if you have vitamin D from a plant source, the body has to convert it to make it more usable. If you have it from a meat source, the body can take it and use it right away. So it's much healthier to have a meat source or animal source, I will say, for some of these nutrients than it is to have from a plant source. So cheese is another excellent source of all these vitamins. So these are things in our modern society that we're actually steering away from when we actually should be steering towards for healthy development for children and healthy maintenance into our adulthood and later years for good support, not only for our bodies, for our teeth, but for our brains. I'd encourage you to do your own research on this information that I've shared with you today. Pick up the Weston Price book and learn where he went and what he discovered. And then there's another excellent one by a dentist named Dr. Stephen Lin called The Dental Diet. He discusses some of the things that I've talked about. These are some of my sources. There's another excellent one. It's called Jaws, and the story behind the hidden epidemic of the shrinking of our faces. So these are helpful sources that explain with a wider, broader picture of what's actually going on in our society today. Thank you so much for watching this video. If you found it helpful, like, comment, or subscribe for more great content.